All right, let's get into it. Today, we're diving deep into the essentials of professional pedicure safety, pulling everything straight from the master book used by the Louisville Beauty Academy. So whether you're a student trying to nail your exam or you're a seasoned pro just keeping your skills sharp, this is for you. Let's jump right in. So think about it for a second. What's the one service that clients absolutely love for kicking back and relaxing, but that, behind the scenes, keeps professionals on high alert? Yup, you guessed it, the pedicure. But why? Why is something so routine considered so high risk? And this quote really says it all. It's from the Louisville Beauty Academy, and it gets right to the heart of the issue. Pedicures are fantastic for business. Everybody loves them, but wow, they carry the highest liability in the entire nail industry. That's a big deal.
Okay, so let's break that down. What exactly is it that makes this super relaxing service so incredibly risky for us as professionals? Well, it really all comes down to what's going on with our feet.
So why are feet such a danger zone? Well, honestly, it's kind of the perfect storm. You've got the constant threat of infection and fungus. Then there's the problem of open skin, and even a tiny crack can be a gateway for germs. And on top of all that, you have to worry about underlying health issues like poor circulation or diabetes, where one small mistake can become a huge, huge problem.
This brings us to what is, without a doubt, the single most important skill you will ever learn as a nail professional. And it has nothing to do with how you file or polish. It's about knowing when to just stop. For the client's safety, sure, but also for your protection. Okay, this next part, you need to burn this into your brain. Your job is to beautify, not to diagnose or treat. The second you think something looks like a medical problem, your only job is to stop and tell them to see a doctor. Period. And listen, doing this isn't just about being nice to the client. It's about protecting your license. It's about protecting your whole career. So, what are those big, bright red flags? What are the things where you just have to stop, no questions asked? Well, any sign of infection, we're talking redness, swelling, anything that looks like pus, that's an immediate stop. Same thing for any kind of broken skin, whether it's an open wound, a really bad crack in a callus, or athlete's foot. And of course, anything that looks like a serious medical issue, fungus, a nasty ingrown nail, signs of bad circulation, that's a hard no. That's a job for a doctor, not you. And if you're wondering what to say, here it is. This is your go-to script. It's professional, it's firm, and it's all about safety. For your safety, we cannot perform a pedicure today. Please visit a licensed medical professional. Practice saying it until it feels natural. Honestly, this sentence could save your career one day. All right, let's switch gears and talk about your toolkit. Because look, being a pro isn't about having the fanciest gear. It's about knowing how to use every single tool with safety as your #1 non-negotiable priority. First up, the foot file, or the foot paddle. This is your go-to for dealing with calluses. But man, how you use it makes all the difference. And this tip from the Louisville Beauty Academy is everything. Your job is to smooth the callus. You are not there to scrape it off or remove it. Think about it. If you get too aggressive, you can easily tear the skin, and that's a direct route to an infection and a potential lawsuit. Gentle is the name of the game here. Next up, we've got toenail nippers. These things are powerful, right? They're designed for thick nails, which means you have to be incredibly careful and precise when you use them. The advice here could not be simpler, but it is so important. Clip carefully. Seriously, one little slip can cause a pretty nasty injury, especially around that super sensitive skin next to the nail. You always need a clear line of sight and a really steady hand. And finally, let's talk about foot scrub. This is what we use for exfoliation. It feels amazing for the client, right? Leaves the skin feeling super soft. But you gotta remember the goal here. We are gently removing dead skin cells. If you start scrubbing like you're trying to get a stain out of the carpet, you're not exfoliating anymore. You're just irritating the skin, and that can lead to inflammation and damage. Not good. Okay, time to put it all together. So what does this look like in practice? Here it is, the official 10-step safety protocol from the Louisville Beauty Academy. If you followed this, you know every single pedicure you do is safe, gentle, and totally by the book. All right, first half. Step 1 always is the consultation and inspection. You have to ask about any pain or cuts, and you have to look. Don't skip this. Step 2, sanitize your hands, their feet, no exceptions. Step 3, the soak. Now listen up, because this is key. 3 to 5 minutes in warm water.
That's it. Any longer and the skin gets way too soft and becomes super easy to damage. 4 is easy, remove that old polish. And 5, trimming and shaping. And the golden rule here, cut straight across. I'm telling you, that one simple technique is the best way to prevent painful ingrown nails down the road. Okay, on to the back half. Step 6 is cuticle care. The process is key. Apply a softener first, then gently push them back, and only trim the dead skin, only the dead stuff. For callus care, number 7, it's the same idea. Use a softener, then gently file with your paddle. Number 8, exfoliation. A light massage with a scrub and rinse it off. 9 is the lotion and massage. Keep it gentle with slow, relaxing movements. And finally, number 10, the polish. Base coat, color, and top coat, all in nice thin layers. That's the secret to a perfect pro finish. Okay, I have to stop here for a second because this next point is probably the single most important thing when it comes to avoiding lawsuits. We smooth calluses. We do not remove them aggressively. That is not in your job description. The second you do that, you're basically acting like a doctor, and that is a one-way ticket to getting sued. You protect them, you protect yourself. Okay, last section. We've talked skills, we've talked procedure. Now let's talk about your mindset. Because look, you can know all the steps, but true confidence, that comes from what you believe about yourself and your work. And the Louisville Beauty Academy has a great way of framing this. They call it the yes, I can mindset. It all starts with this. Yes, I can perform pedicure safely. You gotta believe it. Trust your training, trust the protocol. Know that you have what it takes to do this right every single time. Next up, yes, I can protect clients. This is your mission. When a client sits in your chair, you are their protector. You're the guardian of their health and safety. Every move you make, every decision, it's all about keeping them safe. And for all you students out there, this one's huge. Yes, I can pass my exam. Following these rules isn't just about being a good professional someday. It's about proving right now that you have the knowledge and the discipline to earn that license. So that brings us to the final question. Are you ready to go from I can to I have? Because internalizing all this stuff, the skills, the safety rules, the mindset, it's about so much more than just passing a test. It's about building a career you can be proud of, one that's successful, safe, and, really rewarding. So are you ready to say it? I have done it.